Thank you very much, and welcome this afternoon. So there's a couple of updates we have this afternoon, first of which is that we have identified 2 new presumptive positive cases. Both of them are related to the case we announced on earlier this week. I'm not sure what day it is, from Tuesday this week. And further investigation within that household has identified that 2 people who are both visitors from Hubei province were in contact with the individual who was a case that we announced on Tuesday. So these 2 visitors are a man and a woman in their 30s, and they have had illnesses that are compatible with the novel coronavirus, and in the course of the investigation, they have both tested positive. And we are, having done the epidemiology and the investigation within that household, one of these individuals is very likely, and we're quite confident, is the source for the case that we announced on Tuesday here in British Columbia. So just to clarify a few of the issues around the household, there was some concern expressed to me that perhaps there was asymptomatic transmission. That is not the case. The individual who was the source for our second case did have a compatible illness, but it was a relatively mild illness. And that is something that we're recognizing more and more from the cases that have been recognized in China, that young people, particularly young healthy people, can have very mild illnesses that may appear like a cold. This person did not seek medical attention for his illness, and is likely the source of the illness in the woman that we identified earlier this week. So Vancouver Coastal Health continues to monitor and closely provide assistance to these people. They all remain in the household in the Vancouver Coastal Health region, and they're all in isolation. So a number of close contacts as well as the 3 cases. So this is the major update we have today. The other piece that is somewhat related to this is the changing recommendations that I spoke to earlier this week around people who have come from Hubei province. And we know that the number of people who are leaving Hubei province now is now quite small, and in the order of 50 to 60 people a day across the country. However, we also know that there are people who are in BC here now, who have been in Hubei province, and as this case demonstrates, may have had a mild illness compatible with this, and may have issues with others in their close contact who may be incubating this disease. So for that reason, we're reaffirming again the importance of monitoring for symptoms, and for people who have been in Hubei within 14 days, to make sure that they self-isolate and stay away from others. So what we're asking people to do is to stay away from work and to keep children home from school for the 14-day incubation period for those who have been in Hubei province or have had close contact, so living in a household with somebody from Hubei province. We're also asking them to contact us in public health, and you can do that by calling your local public health office or by calling 811, and we'll connect you with your local public health office so we can support you in how to do that and how to monitor for symptoms, the types of things that you might have questions about how to do this effectively. We've also notified our partners, for example, in education, about these measures and the importance of these measures. For anybody who's come from other areas of China, we continue to tell them how important it is to monitor carefully for symptoms, and if you have any symptoms, even of mild illness like a cold symptoms, to please connect with us, and then we can work with you to determine whether assessment and testing is needed and how to do that safely and appropriately in our province. So that's the really important change that we've made now. I think it bears repeating that this is a really important measure for us to connect with people in the community, to provide them the support and the advice we need. This virus, as we're seeing, doesn't respect the political borders that we've put in place. It doesn't respect it moves around the world, transmitted through the air. So we need to all be cognizant of the fact that we're vulnerable together as a global community to this virus. It's a time when we need to work together, we need to support each other. And we have been hearing some very disturbing references to China and Chinese people, and the fact that Chinese communities are feeling at risk here. And this is a time where we need to work together and support each other. These viruses know no boundaries, and it is something that we all need to do collectively to support people. If we start ostracizing people because they're sick, that makes it much more difficult for us to do our job in public health, to identify people and to be able to support and monitor them and safely care for them when they have this illness.